We are absolutely thrilled with the clinical outcome data that our colleagues are sharing with us, those who have installed the LifeAire system throughout the U.S. They're sharing their clinical data, images of their embryos, their cryopreservation rate, blastocyst conversion rate, now transferring fewer embryos. The efficiency of the IVF cycle has increased across the board. One program saying they went from 40% clinical pregnancy rate to 60%, changing nothing but adding the LifeAire system. Others have an exceptionally high under 35 years of age pregnancy rate, 72% under 40 years of age. The numbers have been overwhelming, and they've been kind to share those with us. We not only look to that data, the clinical data, but also the third-party air testing data that is occurring throughout the U.S. as well. And combining the two, try to continue to push the technology to be better than it is. We're working on next generations, pretty much around the clock, next generation systems to improve the technology for improved patient care. Another thing, other than the data coming clinically in air testing, there's data coming when we remove or do the change out of the first set of media, first set of filters. We take those filters, send them to a third-party lab, and they're tested for life left. That tells us a tremendous amount of information about their particular location, and is there anything else that we can tweak or improve to make sure that they maintain the level of air purity that's delivered to that laboratory. So all pieces of data are invaluable to us, and we're thrilled primarily with the clinical outcomes because the genesis of this was to solve a problem, and this was done for the couples going through IVF and for their embryos.